Good evening, friends. Good evening, friends. I'm Dr. Kavita Shah. I'm a consultant gynecologist at Star Hospital and Kavita Hospital, Surat. Uh, Today, the topic of my discussion with you, friends, is importance of calcium during pregnancy. Now, a why pregnancy is a high demanding state. Not only pregnancy and lactation, both are high demanding state because pregnancy is not only associated with the mother, but baby head also has to grow. If the mother's nutritional status is going to be weak, automatically the baby will also grow heavy inside the mother. Uh, and in case if mother does not take adequate nutritional supplements, baby as a parasite dependent on mother will take away all its requirement from the mother and hence make the mother weak. Now, the, of the two important nutrients of pregnancy, one is iron and one is calcium. Today we'll discuss about Today we'll discuss about calcium, importance of calcium during uh, importance of calcium during pregnancy, and why is calcium important? Calcium is important for the mother as well as for the mother. It avoids many complications. If calcium is taken after 14 weeks, 3.5 months of pregnancy, there are 50% chances of reduction of preeclampsia. Preeclampsia, preeclampsia is rise of blood pressure of the mother during pregnancy. Mother's blood pressure rises during pregnancy, and which is very risky and dangerous for the mother as well as for the baby. So, when if you want to reduce the chances of developing high blood pressure during pregnancy, you need to take calcium supplementation because of high blood pressure. Sometimes the baby has to be delivered earlier in around 7 months, 8 months, and hence there are chances of preterm birth for a baby. And a preterm baby has its own complications. So calcium is very important during pregnancy. And uh, now when we move on, we have understood the importance of calcium in pregnancy. Now we will talk about the dietary sources of calcium. Talk about dietary sources of calcium. We can divide it into vegetables and fruits. Of fruits, calcium and sitafel are rich sources of calcium, and in vegetables we see broccoli and drumstick are good sources of calcium. So apart from that, if we go for milk and milk products like cheese, curd, milk itself, they are also good sources of calcium. These are the vegetarian sources of calcium. In non-vegetarian food, also enough amount of calcium is available to the mother. But alone dietary calcium, that is from fruits, vegetables, milk, and milk products, is not enough for the mother as well as the baby growing inside the mother. No, only one watching. No one is watching without me. Mother and the baby. So now when we want to talk about the supplementation, the patient has to take calcium supplementation, which is uh, in the form of tablets. And the tablet should be 500 milligrams. It should have 250 units of vitamin D3 along with the calcium. So vitamin D3 along with calcium that is 500 milligram of calcium along with D3, that is 250 IU. Such there should be one tablet two times a day. That is uh, one tablet after the meal. It should not be taken empty stomach as it can cause gastritis, that is acidity. Calcium tablet also should not be taken along with iron and folic acid tablets because taking it along with iron and folic acid tablets would reduce the absorption of the iron salts. At least there should be a 2 hours of gap between taking of calcium and iron folic acid tablets. Now, for the side effects of calcium, there are no great side effects with levels of calcium. The only known side effect is gastritis. And so it should be taken always with meal. One tablet after lunch and one tablet after dinner. And there should always be a gap of 2 hours between a tablet of calcium and tablet of iron. So just taking one tablet two times a day, that is around 1 gram of calcium per day, will decrease the chances of uh, preeclampsia, that is the rise of BP in pregnancy, and preterm birth in the and its complications in the baby. Now we will move on to the question answer sessions. And I would like to answer a few questions that many of you have asked just now. Yogendra Mishra, the dose of calcium is 500 milligram per BD or OD, it is BD, it is two times a day. 500 milligrams alone calcium is not to be taken, it is to be taken with 250 IU of vitamin D3. Home remedy is Jenny. Any home remedy is remedy are fruits and vegetables. Foods like calcium, sitafal, original calcium are sitafal, banana, vegetables like broccoli, drumstick, milk and milk products, and non-vegetarian. Along with calcium, what can Jenny? The other question is what can be done to improve my bone strength? Along with taking of calcium rich diet, you have to take calcium tablets. Along with calcium tablets, you also need to do exercise because calcium with vitamin D3, with exercise, with food supplementation will together help in mineralizing the bone and improve your bone strength. It definitely does. Jenny, another question is: does it really affect my bone strength? Yes, it really affects your bone strength. Um, yes, it really affects your bone strength, so definitely you need to take calcium supplementation. Jenny, your another question is: what is the role of calcium in daily routine? Calcium deficiency can cause, beginning with an acute deficiency, can cause muscle cramps. You can eat every minute of your legs. You can get leg cramps. You can get cramps in the hands, on the floors. You can get jitters. And the long-term role of calcium is it is needed for the strength of the bone. If the calcium in the bone goes down, it causes osteopenia. In such patients with a small form, there are high risk of that bone getting fractured. So there are increased chances of fracture in this patient with calcium deficiency. Revati Rajamani, I have good evening, Revati. Your question is what is the role of calcium during pregnancy? As I've mentioned, if a patient starts calcium is to be started within 14 weeks of pregnancy to 6 months of lactation. That is practically a long period of a year. She has to start from 14 weeks of pregnancy to delivery, and 6 means 6 months post delivery, she has to take because calcium, first of all, will protect the mother from her bones getting resolved. Her bone calcium will be maintained. Second, she will be protected from preeclampsia, that is rise of high blood pressure, rise of blood pressure in pregnancy, and the risk of preterm birth in the baby. Calcium is a very important nutrient which is required during pregnancy. What happens if you don't take calcium during pregnancy? If you don't take calcium during pregnancy, you are at 50% more risk of getting high blood pressure, preterm deliveries. Later on, your bones will get resolved and your chances of getting fracture because of osteopenic bones increases. Bhavna, good evening, Bhavna. The question is, in which trimester is calcium most important? Right, Bhavna, calcium is most important in second and the third trimester and in lactation. So you have to take calcium after 14 weeks and you have to continue till 6 months post delivery in the lactating period till your baby starts taking the food from the other than the milk. Good evening, Sonam. Your question is necessary to take calcium during pregnancy. Sonam, I've answered it. It is very necessary to take calcium during pregnancy. I've already given the answer for it. Hello, Madhvi. Hello, ma'am. If I'm taking nutritional food daily, then I need to take calcium supplements. Yes, if you are taking, Madhvi, if you are taking nutritional food daily, till then also you need to take calcium because the requirement of this calcium will not be fulfilled by your nutritional foods only. You need to take extra 1 gram of calcium apart from your nutritional foods. Hello, Kavita. Uh, your question is, can we take iron and calcium together during pregnancy? No, you cannot take iron and calcium during pregnancy together during pregnancy because calcium will decrease the absorption of iron if both are taken together. There should be at least a gap of 2 hours between taking iron and calcium. Hello, Rebecca. Your question is calcium supplements necessary? Hi Rebecca, if you have been watching my videos, you might have learned this multiple times. Calcium is a very important supplement to be taken during pregnancy for a mother to protect herself in acute state of preeclampsia and later from calcium deficient bones for the baby to protect the baby from preterm birth. Good evening, Lakshmi. Your question is, what are the symptoms of calcium deficiency in babies? When the baby is born, if the baby is calcium deficient, then the baby may have to turn, or the baby may need an ICU admission because of uh, metabolic problems. Good evening, Lakshmi. The question is, which food has the most calcium? Like banana and sitafal has maximum amount of calcium in it. Lakshmi, your question is, can I take folic acid and calcium tablets together in pregnancy? Yes, Lakshmi, you can take folic acid and calcium together during pregnancy, but you cannot take iron and calcium together during pregnancy. At least you should have a 2 hours of gap between the two tablets. Hopefully, I'm waiting for a few more questions. If anyone has to ask, I'm waiting for them. By the meantime, I would like to share my details on BabyChakra. My code is KAVS. If you have any questions regarding any nutritional supplements which are necessary during pregnancy, you can just put it to me. help me answering it. My code on BabyChakra is KPF. So I think so we have done with the question answer session. Thank you very much, everyone. And remember, my code on BabyChakra is KAV.